Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video, we're going to be looking at the internal rotation lag sign. This is a special test that's used to assess for a tear to the subscapularis muscle of the rotator cuff. And it's performed very similarly to Gerber's liftoff test, which we covered in a separate video. And for that reason, this test is sometimes referred to as the modified liftoff test or modified liftoff sign. So let's take a look at how that test is performed right now.
So, to check for an internal rotation lag sign, the patient will be positioned either in standing or sitting. The PT stands behind the patient, as you see right here, and the PT will control the patient's arm at their elbow and their wrist or hand, and bring that arm behind the back passively into functional internal rotation. That's internal rotation behind the back. Let's take a look at that right here. So passively moving the arm behind the back, and then we're going to bring it away from their back, so not in contact with their back at all. One obvious stipulation on this test is that in order to be able to do it and interpret the results, the patient has to have the passive range of motion to not only bring the arm behind the back, but to have it moved away from the back. So if you are going to try and do this test and you bring the patient's arm behind the back, but you're not able to lift the forearm off, you can't do this test. It's not valid. Okay? You have to be able to passively move it off. And there are definitely patients who will lack that passive range of motion right there, so you can't do it. And you would have to rely on other tests like the belly press test or the bear hug test, which we covered in a separate video. In any case, we're about to see a negative test. So what I'm going to do is I'm going to keep my hand on her elbow. That stays constant, but I'm going to let go of her hand and wrist. And I'm going to instruct her to hold her arm in this position and don't let the arm come back to the back. Okay? Let's take a look at that right here. So I'm going to let go, and she's able to hold her arm in this position. Okay? This would be a negative test, and it would indicate that she has sufficient strength in her subscapularis and likely also has no tear to that muscle either. Okay? So that is a negative test. And if you have a negative test, the sensitivity value is 97%. So there's a 97% chance that she does not have a tear of her subscapularis. Now, obviously, there's always a 3% chance that this is a false negative. So you would, of course, correlate this with the results of other subscapularis special tests. Let's take a look at a positive test right now. So a positive test is where there's a presence of a lag. And this is the inability to maintain the test position as indicated by the hand moving back towards the back or coming all the way back to the back. Okay? So same initial component. We're going to bring her into passive functional internal rotation. We're going to move that arm away from the back and let go with the right hand. And notice in that case, when I let go, her hand comes back to her back. Okay? Let's take a look at that one more time. Passive functional internal rotation, maintained hand contact at the elbow, but when I let go, she's unable to hold that test position. This would be a positive test. And the specificity for this test is 96%, also really good. So if this test is positive, there's a 96% chance that she has a tear of her subscapularis, or at the very least has weakness. Okay? And of course, if there's shoulder pain and this test provokes that familiar shoulder pain, again, it's more likely to be a tear in addition to weakness. All right? So hopefully this video gave you a good understanding of the internal rotation lag sign test. Be sure to like this video, subscribe to my channel, and hit that notification button for notifications for all videos in the future. Thank you so much.